Hello everybody, welcome back. I want to say thank you to my patient for agreeing to this filming. I'm going to show you today a classic but extended tummy tuck 360 liposuction, including the full back for a patient who had kids before and has been on Mounjaro with some weight loss as well. As you all know, Mounjaro, Ozempic, and the others are GLP-1 agonists. They help losing weight. They're good for diabetes. They're good for a lot of other things, including anti-inflammatory component for lipedema patient. This lady is doing it for weight loss purposes. I always like to point out that patients on those medications do have to stop it 2 weeks prior to surgery. Other than that, they can resume a few days after surgery. So we've already done the liposuction 360. I do like to turn a lot of our patients for 25 years at the office. We have a safe way to turn our patients efficiently. I did full back, so I commonly do the lower back roll, but a lot of our ladies have also the bra rolls at the back upper part. So I did a full back. I was able to remove 2,100 just from the back. There was some bands tethering, especially in the midline. She had almost like a cleft. So I was able to subcise or cut the adhesions from the dermis down to lift that adhesion, very deep cleft or crease she had. Now I've turned her back. We're going to do liposuction to what's left of the flanks here. Liposuction here. This part will be excised, so you can see it's an extended because I'm going a bit further away. It's basically where her fold ends. We're going to remove all this. We're going to liposuction that. I'm using her old scars from breast reduction to go from above down. It's always safer in liposuction surgery when we get close to the ribs to go from above down. It's something I've done for 25 years, so that when we go from below up, you obviously don't want to go under the ribs. So I do a lot of the side lipo from below, and the upper lipo, I do it always from an incision here. Fortunately, this lady has scars there already, so I'm using them. We're going to do a tight muscle repair because when she stands, she has both internal and external fat, but also the muscle has been weakened with pregnancies. Stay posted. I will show you part 2 at the end. Hello everybody, welcome back. This is part 2 of our extended abdominoplasty 360 liposuction upper, mid, lower back, flanks, abdomen, muscle repair. Interestingly, with our lady here, when I did the plication, like you've seen me doing before, she bulged on the outside here where the external oblique muscles are. So what I did on her, which we do once in a while, I did also a plication of the external oblique. So usually we do plication of the rectus abdominis muscle, but she was bulging out here. Obviously we're pushing down, so things may bulge somewhere else. So I did some oblique plication on the sides here to really singe her waist. I was able to remove 4 liters of fat by liposuction, and the specimen here, the pannus, we call it, the excess abdominal skin, weighs 1.5 kilograms, so almost 3 pounds. This is the specimen here I will show you. Then I will show you the final result. Here we go. So 1.5 kilo. This is the belly button where it was attached. We detached it. And this is slightly longer because her fold was extending to the sides. And those are the little stab incision for the liposuction. And the final result. Now there are little indentation. This is because we do the quilting closure to close the dead space inside. We also leave some blood vessels on the sides. And now you'll see the pre-op result where she was relatively full and wide. And now we were able to narrow, cinch the hourglass shape. Those indentation is from inner suture that we close the dead space inside her belly button. Nice incision, very symmetrical, very low. We're about 5-6 centimeters above the genital, so it's easily hidden in the underwear section. Those creases will be all gone next week. She will never see those. This is our classic extended abdominoplasty, 360 liposuction, plication, repair of the muscles. We did 4 muscle repair today, and umbilicoplasty. Thank you for watching.